we'll be discussing 4 critical commitments. As a professional helper, you will have to commit yourself to 4 core values, and these values will be critical to you throughout your professional career. A commitment to lifelong learning, a commitment to collaboration, a commitment to values-based practice, and a commitment to beneficence. Now, being a professional helper really is a field where you have to be committed to lifelong learning. The task of learning is never done. There will always be new assessment tools that are released, new theories that are being developed, new interventions that you'll have to learn, new technology that you'll have to adopt. The DSM is always being changed and revised. Diagnostic categories are changed. Diagnoses are added and removed. So you'll always be learning and developing new skills. You'll attend workshops and conventions. You'll keep up with the research and read scholarly articles and books. You'll obtain supervision from people who have more experience in the field than you do. And of course, you'll seek out your own personal counseling to address any personal issues that can influence your work with clients. You'll also learn from the clients themselves. Through your work with them, you'll be educated about different cultures. You'll learn about different experiences and how they affect people. You'll learn how the same diagnosis or the same disorder may present itself totally differently in different clients. So you'll learn from the clients directly. You'll also have to have a commitment to collaboration. So certainly you'll be collaborating with your clients. You'll be negotiating the goals and tasks of therapy with your client. You'll be engaged in shared decision making. So you'll make clinical decisions together, like things like which issue to focus on first, how to break down goals into sort of mini goals, how to determine when it's time for termination or referral. So these are things that you'll work together with the client on. You want to make sure that you don't misuse your power. As a therapist, you always have the one up in the therapy relationship. You want to make sure that you don't use that to try to coerce your client to make certain decisions or to try to get them to adopt your values. But also, you don't want to deny your power. Again, this is a collaboration. So even though the client does have to work and does have to, want to bring about change in themselves, it is not solely their responsibility. You have to accept the power and the responsibility that you have in the context of that relationship. You'll also be collaborating with other professionals. This can be seeking out consultation with your peers, again, seeking supervision. You may be working with other professionals on articles or research. So that's another source of collaboration. You'll have to have a commitment to values-based practice. So values-based practice refers to learning from others, from clients and other professionals for the sake of providing quality care to a range of clients. So you want to respect the values of the clients while still upholding the standards of professional and ethical practice. Now, to be honest, some values that we hold may make it difficult to feel empathy towards certain clients. That is to be expected. There are going to be times where you'll have difficulty creating relationships with certain clients because of some type of conflict in values. But referral is only necessary if the helper lacks the competence to be able to promote and respect a client's welfare. So simply having a conflict in values is not a reason to refer a client. A referral is a step of last resort. So you refer clients only because you lack the competence to be able to work with them, not simply because you hold values that may be in conflict. If you do have values that conflict with your client, it is your responsibility to go and seek out the training, seek out the supervision, seek out the consultation that you need in order to be able to effectively work with that client. And finally, a commitment to beneficence. And this is purely doing good for your client. Now, the ethical code for APA talks about beneficence and non-maleficence. So non-maleficence is doing no harm. So that is certainly the first ethical step toward being a good helper. But you have to go beyond seeking not just only not to harm your client, but to help your client. And so you'll always be acting in the client's best interest.